Good morning, everyone, and welcome to episode 251 of the On Air Advocate. Where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate. And I am super excited if you are joining me here once or twice this morning, morning hours, or you are catching this on the replay. Now, as always, if you think any of the content that we are talking about today could be relevant for anyone in your network or your circle, please hit the share button on whatever social media application you are watching this show from this morning. Well, if you guys have been following us this month, you know that it is National Cancer Prevention Month. And I am so excited to welcome back to the show Wendy Garvin Mayo. She is absolutely amazing. She is an oncology nurse practitioner, cancer caregiver consultant, an author and a speaker, and just phenomenal. So I wanted to bring her back because she had so much good information for us last time, and we're going to be chatting about those 3 levels of cancer prevention today. So welcome back, Wendy.
Thank you so much for having me, Terry. It's great to be here this morning.
Yes, and I'm thinking to myself, well, if people watch the segment at 5:30, they're probably thinking, wow, she must have had some coffee or caffeine right now. Oh, at this time. So Wendy, in case people didn't catch that last segment that you were on, can you just tell people a little bit about your background?
Yes, so my name is Wendy Garvin Mayo. I am an oncology nurse practitioner. I'm a cancer caregiver advocate and consultant. And I've been in nursing for over 16 years, spent the majority of my career caring for cancer patients and their family members in all capacities, whether that's inpatient oncology, outpatient oncology, and or research. So I run the gamut, but I'm very passionate about oncology, especially, the patients and the caregivers.
Yes. And that's what kind of led you into this cancer caregiver network that you've put together, is just because you feel that there needs to be so much more support that isn't always there.
Yes, that's correct. So I'm also the founder of Shape Partners. So Shape Partners, we empower cancer caregivers to really optimize their health and wellness. And we do that through our 4 pillars, which are partnership, advocacy, coaching, and education. And yes, Tammy, just based on my history being in the clinics, I support obviously cancer patients, but their caregivers, right? Because that's holistic. That's a holistic approach to caring for a patient. And there's a gap there because, a lot of our services are geared towards the patient, but the caregivers are kind of left in the gap, so to speak. Yeah. So I developed Shape Partners to really fill that gap for caregivers. And there's a lot of research out there that shows that caregivers also are on this cancer journey and suffer from, emotional and or physical stress, their health decline. So they definitely need services and support as well.
Yes. And I love the mission that you're on with this, because I've seen that so much. And, different though, we kind of title everything caregivers. When you are a cancer caregiver, it's something that's usually thrusted upon you, right?
Correct.
And so thrusted upon you. And, inevitably you might know that it might be this short set of time, maybe a long set of time, might be this short set of time, but everything kind of packed into one, right? You're on this journey of rigorously now going to treatments and therapies and all of that. And so I love what you're doing, Wendy. There's just such a need. There's just such a need for it out there.
Yeah, no, thank you. And the thing with cancer, is you can't really plan for it. One doctor's visit can change your whole life, right? You walk in that doctor's office one way and you walk out a totally different person. So your whole life just shifts for the cancer patient and the caregiver. So, there's really no planning for that, right? Planning for that role, so whether it's your personal life, your financial life shift, there's so many shifts, your professional life shifts. So, really Shape Partners is there to really help you on that journey, be with you on that journey, provide you with the resources to really just help decrease the impact that has on the caregiver.
Yes. And as we have our title today of our 3 levels of cancer prevention, I think let's start there, because I think there are some, general things, right? These top 3 things. And then as we discussed before we hopped on the show, there are a few things that are kind of like off branches from there that we can kind of chat about. But what would you say are those 3 most important levels of prevention?
Yeah, so when you talk about cancer prevention, I want to talk about in the sense of wellness and health promotion, right? So we are all responsible for our health. So primary prevention, you could think about it in terms of prevention, right? So you'll get that in a minute. So primary prevention is things that we can do to really decrease our risk of, being diagnosed with cancer. So I'll use breast cancer as an example through the 3 levels. So as we know, a risk factor for breast cancer is obesity, drinking alcohol, right? Smoking. So primary prevention, what you can do is really, exercise, eat healthy, decrease your alcohol intake. So primary prevention are things that we can do to decrease our risk, whether that's vaccinations, whether that's, like I said, exercise, eating healthy. So anything you can do proactively to really prevent from getting cancer or being diagnosed with cancer, so decreasing those risk factors. So that is primary prevention. Now, when we talk about secondary prevention, or you can look at that as screening. So screening is what you do to detect the diagnosis. So those will be your tests. So I'm going to start from very basic. It's very important to, go to your wellness visits with your doctors. You don't need to go to the doctor just when you're feeling sick. So those wellness visits are essential, right? So you go in, your blood work is screening, right? It can be screening for cancer. Your physical examinations that your doctors do, that's also secondary prevention. In our example of breast cancer, your mammograms, your ultrasounds, endoscopies, colonoscopies, all those are secondary prevention. So all those are screening. Even, going to a dermatologist to get your skin exams done to see if you have moles, right? Or lesions on your skin. So anything that is in place to screen or detect the cancer is secondary prevention. And I also want to say this, in the midst of COVID, I know a lot of us have been putting things off, but we definitely want to stay in touch with our healthcare providers, even if it's through telemedicine. Let's not wait until things are bad or we're having pains or symptoms. Let's try to be proactive about that. So just because COVID is here and we're in a pandemic, we can still be in touch with our healthcare providers. So I just want to say that.
Yeah, I mean, I think that is so important because I've heard so much. People are like, oh, I don't want to go to the hospital. There's people that, you might get COVID or, you're exposed to more germs. And my thought is, well, on the flip side of that, if you don't go in and you don't get checked, and by the time you do, you have, full blown stage 4 cancer. You know what I'm saying? There's a lot they can do about by not getting those rechecks, just how important that is. I know through the process of COVID, I had to go back in for a double check of my breast exam as well, but I was kind of on them too, like, okay, whatever is the soonest date, you're reopening your clinic.
Yeah.
I want to be there. So I would definitely urge people to not put that off.
Yeah. And also, it's a known fact that many people have, passed away at home because they're not going to their doctor or the ER. Yeah. Right. People are having pains or issues and, COVID's preventing them from going to the ER and people are, trying to deal with things at home, but don't wait. If anything is going on, don't say, I'll wait a day, I'll wait next week. Don't do that. Call your doctor, have a conversation, at least have an appointment in the books, or they can triage you over the phone to say, hey, this sounds like something, maybe you could take it over the counter for, or you need to get to the ER right now. But, keep that line of communication open between you and your healthcare providers. So that is so essential.
Yes, definitely. And what would you say that's kind of like that third layer of prevention is?
Yeah, the third layer of prevention, you can think about it in terms of treatment. So for our breast cancer example, that would be chemotherapy, hormonal therapy, immunotherapy. So treatment in the sense of after you're diagnosed with, with cancer, it's what do you do to really reduce the burden or progression of cancer? And the goal there is really extending life and increasing quality of life.
Okay.
That's the third level of prevention.
Okay. And I know that before before we got on the show today, we kind of got into a few little discussions, though they're big discussions. And, you know, one of those big factors we talked about was really knowing your family history. That's such a huge thing. Can you speak to that a little bit?
Yeah, so family history is so essential. And you know, cancer in general is a topic people don't really like to talk about, but it's so prevalent. It's so prevalent, you know, in our society that, you know, learning your family history is essential because your family history impacts you. And many times people don't talk about it, don't really think about it until it hits home. But, you know, if you have family members who've been diagnosed with cancer, it's really important to understand what type of cancers, right? And also communicating that to your healthcare provider. So, you know, they know how to screen you. Do you need genetic testing? You know, so, you know, Tammy and I were talking about, you know, even putting this as early in high schools, right? So even for our children, really instilling that in them, the importance of knowing your history of cancer and other diagnoses, you know, even those chronic illnesses, diabetes, high blood pressure, heart disease. So family history is just so essential.
Yeah, and I think that sometimes it's not until you are diagnosed with something that you reach out and maybe you're talking to another family member and they're like, "Oh, well, my cousin Joe passed away of this, and you know, your aunt Rita passed away of this," and you're like, "Oh, well, why didn't I know that?" You know, beforehand. And I mean, I would even talk even off of just cancers like heart disease and everything else. Who's all had heart attacks? Who has high blood pressure? So many of those things we have a predisposition to, especially if they're, you know, in our families, and definitely things that we can alter by the type of prevention of exercise and eating well and having good wellness. And you know, there's been a lot of conversations about self-care, self-love, and the levels of stress and how that can bring illness onto us. Have you looked into, you know, any of that, like the levels of stress, how that's sometimes the pivotal point for people that really opens you up to other things?
Yeah, so it's funny that you mentioned that, Tammy. So, you know, managing your stress or developing stress management solutions is a primary prevention. And stress, as you know, can decrease your immune system that puts you at risk for all types of diseases. And there's some research that shows that, you know, decreased immune system puts you at risk for cancer. So stress management is essential, especially during this time of COVID. I actually started a stress management program for individuals. It's a coaching program that really help people hone in on really developing and adopting stress management strategies. And the goal of that is to really optimize their health and wellness, because it's definitely related. And you know, stress really impacts all dimensions of our lives. And there's 8 dimensions, you know, that I kind of focus in on. But especially during this time of COVID, everyone is so stressed, and you may have to really, you know, try things or do things that you haven't done before, right? Because we've never been in a pandemic. Well, most of us have never been in a pandemic before. So really helping people through that is essential.
Yes, yes, because I think on the other side of this, we're going to find that there's a lot of additional repercussions aside from just COVID, you know, of stress and uncertainty, and especially for those that process it more in a physical manner, whether it's overeating, undereating, ulcers, all of those things, you know, are huge things to just think about in managing that well.
Yeah. Oh, sorry.
No,
I was going to add, even, you know, mental illness. So, you know, anxiety, depression. Well, this is all stress related. A high blood pressure, like you were saying, ulcers. You know, infertility for women. You know, your hormones. It's an imbalance there. You know, even for men, you know, impotence or not, you know, being able to enjoy your sex life, which is important, you know, for most people. So it can definitely impact all aspects of your life.
Yes. So putting that on the list as well, having those family conversations. And I know we didn't hop on last month, but last month was Cervical Cancer Awareness Month. And when we talk about female health, oh my goodness, I've never had my alarm go off. I must have thought that you were coming on 30 minutes after you're coming on. That's what I do. Do you do that?
Yes.
Set an alarm to make sure that you are where you need to be when you need to be there. Last month, we didn't focus in on cervical cancer. We didn't jump on for that. But is there anything that you would say outside of those 3 levels of prevention? We talk about female, health in that way that are great things to just remember.
Yeah, so cervical cancer, in terms of that, there's a vaccine out there for HPV. So again, I'll start at the top of knowing your family history. And also getting your annual pap smears is essential. So not only your primary care doctor, but also your GYN doctor is also important, because that's where you're going to have that secondary prevention, right? That screening is your pap smear. So that is definitely essential. And also, if you're having any symptoms of, whether it's vaginal discharge, vaginal bleeding, pain with sex, anything going on, with your womanly parts, you need to get that checked out. Don't wait. Even abdominal bloating, can be associated with that. So be mindful of your body and be empowered that your body, when something's not right. Right. So don't question yourself.
Yes. And I think that for female health and women's wellness, really trying your best to get to know those direct women in your life, asking those questions to your mom and your grandma, if they're still able to, because that is, so prevalent, when we talk about like breast cancer within families, when we talk about, cervical cancer. And I know that, cervical cancer has become so prevalent that when doctors are doing hysterectomies and whatnot, sometimes they would leave the cervix there, and now they're just like, get rid of it. The chances of it, turning into something, more than that, it's just not even worth it, to leave it anymore. So making sure your history from your family.
Yeah. And I'll also just say this too, while you're at the doctor and, you're doing your due diligence, also be empowered to ask questions. So if you are having a procedure done, what is this procedure? What are the signs and symptoms? What are the side effects of this procedure? So, like you were saying, hysterectomies, that comes with a lot of, different side effects. So understanding that, and also being empowered to, ask questions, but also not feel pressured to make a decision, and you can ask, how much time do I have to make a decision? Because you want to process and be comfortable with the decisions you make pertaining to your health.
Yes, yes. And about a year and a half ago, I underwent having a hysterectomy, and that also came from that my mother had endometriotic cancer, and I looked like it wasn't all there yet, but she's like, it just, needs to go. So knowing that history is so important to make those decisions, especially if you're younger and you're diving into something, you want to make sure that you're making that right decision that way. But knowing what really your percentage, your risk rates are of this, turning over and changing, so important. Like you said, with any of these things, can be complications. There can be a lot of life altering things, when you're doing it, but it's just kind of weighing out those risks,
Yeah, can I say something to that, Tammy? And sometimes, we have to be the change agent. So you can normalize that conversation.
Right.
So, family members may think, oh, talking about cancer or family history is not like a thing. You can make it a thing. We're living in, new times. So you can definitely be that change agent to really start having those conversations at the dinner tables or when everyone's gathering or via Zoom right now. It's just so important to be proactive.
Yes, definitely. And, in wrap up, what I wanted to speak to is as we talk about those levels of prevention, we do know, especially for, children and some adult cancers, that there are cancers that are out there that there really isn't a lot of treatment, what I'm saying, or they're newer. They don't have a lot of research. They don't have a lot of funding dollars, and they're still trying to figure it out. And so when families are listening to a segment like this and they're thinking to myself, well, I've lost my loved one, or, I'm saying, I'm going through this journey right now. And basically they're still giving me that it's inoperable, no matter what the outcome is going to be. What are those things supportive wise that you would say to make sure that you've kind of brought into your circle during those times?
Yes. So I will start at the top and say, for those individuals, or, your loved one is diagnosed with a terminal illness, I'm a big advocate for golden moments. So really spending that time creating and enjoying those golden moments. That's just the time you have, and you just soak it all in. That's so important. The second thing I would say is really find community. It's important to be in a community with like people who can support you and see you through it. Maybe someone who is in the same boat as you, or who was in that boat with you, and, can provide you with some strategies to get through, or what worked for them, what didn't work for them. But, having those open conversations, because many times when you are a person with terminal cancer, or you're a caregiver or provider of someone with terminal cancer, people don't know what to do or what to say. So some people may leave your side, your friends, your family. So it's definitely important to find people who understand, who you can speak with openly, right? You may have some feelings that you're not really comfortable talking to family members or friends about, but if you find that community, you'll be able to express yourself openly without judgment or guilt.
Yes, yes. So important. Well, Wendy, I thank you so much for being here bright and early this Friday morning.
Yes, awesome.
I so appreciate it. And if people want to find out more about the, information, resources, or just connect with you in general, where would they do that at? Where's the best spot?
shapepartners.org. That's shapepartners with an S.org.
Okay. And is there any webinars or any classes or anything coming up this month that, you want to let anyone know about?
Yeah, the end of the month, we will have the Shape Your Stress Management Blueprint Masterclass, and that's coming up the end of the month. And I can post that below this video.
Awesome. Thank you so much, Wendy. I appreciate you being here this morning. I'm looking forward to the next time.
Yes, thank you so much, Tammy.
Yes, and if you guys want to know any more about the On Air Advocate, you can head on over to onairadvocate.com, and you can find all of our resources right there. Or if you want to become part of our private community, you can head to the top of this Facebook page. If that is where you're viewing this from, hit the blue button, and that will let you in. And like Wendy said, she will drop her information below. Thanks again. Happy Friday, everybody. Bye-bye.